We live in an exciting age where there's more known about cause and effect of disease and prevention and solutions than ever before in history. Unfortunately, at the same time, we're finding that in our Western United States culture, we're actually getting sicker because there's more chronic diseases related to diabetes, obesity, uh, these different types of problems that we all recognize than ever before. And so the question becomes, what's the role of dentistry in modern medicine? And I want to tell you, the role is very significant. In fact, it's my belief that medicine's next superstar will be the dental team, particularly the dentist and dental hygienist, but also team members, because there's many things related to chronic inflammation, which is the buzzword in medicine today, that can be identified in the oral cavity through dentists and dental teams, through different screenings that we can provide for our patients that are very simplistic. Sometimes they're just written form that can begin to identify signs and markers of inflammation. There's such great potential here to raise dentistry to a level that we never have dreamed of. So I'm calling this integrative dental medicine, integrating all of medicine into dentistry. And there's a way in which we approach this subject that you can do in your practice that is through what I call the 4Bs. So we're going to address bacteria and the role of inflammation and infection through bacteria, not only locally, but systemically. And also we're going to look at the bite relationship, because inflammation through the stress that can be related to poor bite relationships, temporomandibular disorders, clenching and grinding, headaches, etc., are significant to accelerated aging. A third area that we want to look at is breathing. We understand now that if we can't breathe well through our nose, if we're having congestion in the nose and problems breathing at night, sleep apnea, disorders that have to do with resistance and natural breathing, that creates stress in the whole body. This is something that is a growing topic in dentistry, where we can become involved in screening, diagnosis, treatment modalities that can resolve these breathing type problems, sometimes through oral appliances, sometimes through actually changing and expanding the dental arches and opening up the airway, room for the tongue. The fourth B that we will talk about is whole body health. So inflammation factors such as gastric reflux, sleep apnea, nutrition is a very important aspect of systemic inflammation. So these are topics that we can address in dentistry, learn about very easily and quickly, begin to integrate into our practices on Monday. I want to help you do that. I've been fortunate to have a lot of exposure to this. I've traveled all over to learn from the experts, both in medicine and dentistry, on these topics. I'm president this year of the American Academy for Oral Systemic Health, where this is our main subject. I have taught with many physicians and nutritionists and others that are right at the leading edge of these topics, and I want to bring this to you and share this information with your group. I will bring also a checklist whereby we can take right into our operatory on Monday morning a checklist and begin to identify these things through questions we ask in our medical histories, evaluations and observations we make clinically, sometimes written form questionnaires that we can use with our patients, screening, testing, and follow up, even the treatment modalities that will help us succeed. So I really am passionate about this because we have a healthcare crisis that must be addressed. And the only way we're going to address it is to each get rational about taking care of ourselves. And we want to teach our patients, our community, our families, ourselves how to do that. And I'm excited to be able to share information with you that will get you jump started on this subject.